I'd like to present to you tonight a plan for a newly revised school closure and opening criteria. On September 18th, the governing board approved the current criteria that we use. And at that time, with so many unknowns, it was really a good decision to put student and staff safety first. And I will continue to say that. So at the time, it was a great decision, but we've learned quite a bit over the years. For example, the metrics were approved prior to our vaccine plan that we have in place. And we're excited right now that we're in the process of vaccinating all of our staff. And we're really excited about that. I want to add too, and I think it's important to remember, the vaccinations for educators across the state was bumped up to priority 1B with first responders and health workers. And the reason was pretty simple. They were prioritized with the intent to get teachers and staff back in the schools so that we can teach in-person learning. We've also learned a lot in terms of what constitutes safe schools. And we've learned so much in the past several months, and even as late as last week, or a couple of weeks ago, for some of the latest studies that have come out. We also have many students who are experiencing social, emotional, and academic challenges. And unfortunately, some of our younger students who do not have someone to advocate for them are suffering the most. And they look to our schools to be their safe haven. And we can't forget that. That's so important. Kian? One of the things that I said early on was the in-person learning plan was contingent upon numbers in a downward trend in terms of the spread of COVID. And fortunately, we are seeing a downward trend, and that's great news for everybody. And though it's not where we'd love to see it, but we hope it continues to go down and even creates a much more safe environment in our community. A lot of questions have been asked of me that pertain to the CDC and their guidelines online. And one of the things that I'm asked is, why are you opening up schools when the metrics don't align with safely opening up schools? On the Maricopa County Health Department website, there is a statement that I think is real important. And I look like I'm getting ahead of myself here. And I'm sorry, I'll get to that in a minute. But some of the things we've learned are, and here's the study with 56 schools, districts in North Carolina that just came out. And basically, data indicates that schools can reopen safely if they develop and adhere to prevention policies. Here's another article that came out from JAMA, and it was published online at January 26th. And the preponderance of available evidence from the fall school semester has been reassuring insofar as the type of rapid spread that was frequently observed in congregate living facilities or high-density work sites has not been reported in education settings in schools. Another good piece of information that we're learning. And then the lead epidemiologist for the county health department who is working with us, Dr. Rebecca Sonnenschein, quoted that students and staff can return to in-person learning with a reasonably high level of safety when schools maintain mitigation strategies that include mandatory mask wearing, social distancing, and a minimum of 3 feet in classrooms and 6 feet during lunch, proper air ventilation, and hand sanitizer stations. Students and staff must also commit to staying home when sick. With these mitigation strategies in place, along with staff vaccination, PV schools will be providing an environment that is as safe as possible for students and staff to return to in-person learning. So the current benchmark that's in place, as you can see, in order to send students back to the classroom, the testing positivity below 5%, and then cases fewer than 50 per 100,000. So that is the current metric. Yeah, so now I wanted to refer to that notation at the Maricopa County Health Department website. And I think it's important that we read this because there are questions as to why you can open up a school or school district. Cases are still pretty high. So in discussion with ADHS and PDH and ADHS, we have agreed to support those jurisdictions who are able to maintain a safe learning environment with regular school-by-school monitoring, regardless of levels of community COVID transmission. If a school or district does not have enough staffing to maintain a safe environment, or if a school or district experiences a school-related outbreak that cannot be controlled with public health mitigation strategies, MCDPH would support transitioning to a virtual learning environment. I thought that was important to share. Now, this plan we are sharing tonight reflects a departure from a district-wide metric that is used to determine when an entire school district would teach virtually or in person. And it focuses on individual school COVID responses. So Dr. Jarris, could you please go over from here and talk about our task force?
Yes, certainly. Thank you. Yes, as Dr. Lee just mentioned, our proposal is to utilize a COVID response task force to evaluate each school and make a recommendation on whether or not an individual school or perhaps a grade level or class should return to virtual learning. This COVID response task force would include a combination of district level administrators, our lead nurses, school representatives, and the Maricopa County Health Department and medical doctors. You go to the next slide, please. Last week, the initial task force met with Dr. Heather Ross from Arizona State University and Dr. Nick Staub from the Maricopa County Health Department to establish parameters for the task force. Our direction moving forward would be to assess appropriate COVID responses on a school-by-school basis rather than as an entire district. And based on the input from Dr. Ross and Dr. Staub, that focus should be to evaluate the actual spread of COVID within each school setting, not necessarily the total number of cases that are appearing within the community or within the school. Our ability to minimize the spread within our schools should be a key focus for decision making. In this evaluation, we'll be looking specifically at multiple cases that appear within a cohort, such as a classroom, a club, or a team, as well as any potential school-related outbreak. Currently, I'll point out that the Maricopa County Health Department defines an outbreak as 2 or more lab-confirmed cases among students or staff with onsets within a 14-day period who are epidemiologically linked, do not share a household, and were not identified as close contacts of each other in another setting. Essentially, an outbreak is not determined by the number of people who have tested positive for COVID. Rather, it's a measurement of the number of people who contracted the COVID virus within the school setting. And then another important piece for us to also consider is to evaluate our ability to safely continue operations as a school, primarily looking to make sure we have staffing in place to continue operating as we would like to. Next slide. So our plan, some bullet points here, is to ask each school to identify a school level COVID team to monitor the school's COVID cases on a daily basis. Just as they did last semester, they will continue with contact tracing and our quarantine practices based on current county health guidelines. And they will also make any necessary adjustments to their mitigation strategies to continue to maintain a safe campus. Our schools did an excellent job with this when we were in person in the fall. I just want to point that out, that this is very similar to what we already had in place for those 5 weeks that we were open in the fall. When a school does have multiple cases within a cohort or they have a suspected outbreak, they will consult with the district level COVID task force to take a deeper look into each situation. This process will include a consideration of additional mitigation strategies, including a possible return to virtual learning for either the school as a whole or perhaps a specific classroom or a specific cohort. In these cases where we are making that recommendation, the district COVID task force would make that recommendation to the superintendent, who ultimately would decide on a return to virtual learning. So again, this is a deviation from a hard set of metrics to a process. Big part of that, of course, is our the ability to mitigate the transference of the virus.
So in a nutshell, what we are recommending tonight that you revise your September 18 board adoption amended opening criteria and approve a plan that allows for school level teams to monitor COVID cases, continue contact tracing and quarantine practices, and adjust mitigation strategies, and refer multiple cases or suspected outbreaks within a cohort to be referred to the district COVID task force. At that point, the COVID task force would make recommendations to the superintendent, that would be me, or whoever the new superintendent becomes at some point in time, on the need to return to the cohort to school or virtual learning. So we are asking this evening that you replace the district-wide criteria or metric that determines transitions to and from in-person and virtual learning, and to adopt in its place a criteria that calls for individual school assessments to determine transitions from in-person to virtual learning. I'm sure you have lots of questions.
Well, Mrs. Matura, may we have a motion, please?
So moved.
So does anybody have
any
questions? Seeing none, Mrs. Chisholm, may we have a roll call vote?
Mrs. Matura. Aye. Mrs. Greenberg.
I hope you can hear me. I'm getting reverb. Okay. I was going to say a few words. I will simply say I'm not sure that I completely like every single piece of the plan, but I believe we can make it work with everyone doing their part. And I vote aye.
Mrs. Bacon.
Sorry, I had to unmute. There is a lot of feedback. Is it?
It wasn't just me.
No. Does someone have their volume? Computer? This is going to be hard for me to say if I keep hearing myself. Well, I guess I'll go ahead and do that. I can support the plan, so I vote aye.
Mrs. Brown.
Aye.
And Mrs. Case.
And I vote aye.
Thank you. At 9:06 p.m. on Thursday the 4th, motion unanimously.